Hi, everybody. This is Teo. I'm the Chief of House Thomas, and today we're going to talk about infographics. I just wanted to start off by saying that I took a lot of inspiration and information from Evelyn's presentation from last year. I have very big shoes to fill. I also used a Coursera class by Carl Good. The link will be at the end of the presentation. In this presentation, we're going to talk about what infographics are. We're going to give you some tips and tricks on how to have good infographics, and we're going to discuss the CardioNerds angle to infographics. An infographic is a visual representation of any kind of information or data. It's a way to communicate complex information in a visually engaging way. The point is not just to inform, but to also engage and to make the process fun. Why is this important? Because images have instinctively been used to communicate from prehistoric periods. It was shown that 65% of the population are visual learners, and people have become increasingly interested in infographics over the past decade, as we can see on this graph based on Google Trends. Educational materials are more engaging when they have relevant illustrations, and there is research showing that tweets and papers have more reads and impressions if they have visual abstracts. The purposes for the CardioNerds infographics are to clarify complicated concepts, to summarize important points, and to engage the learners. We're going to see multiple examples of the CardioNerds infographics in the future slides. But first, just to go over a few of the tools available to create an infographic. The use of maps is fairly self-explanatory. It's to emphasize location. Charts and graphs can help with numerical data. Diagrams can help you organize the data and emphasize relationships. And photos and pictorials can have multiple uses, some of them just emphasis and engagement. What are the components of an infographic? Text, data, and images. Why are infographics useful? What can we use them for? We can use them to clarify and summarize complex concepts. As we can see in this infographic about aortic stenosis by Kareem. We can use them to organize and plan large amounts of data. Very masterfully done in another infographic by Kareem, this time about cardiac amyloidosis. We can explore relationships and comparisons. See here in an infographic by Gerline about coronary artery calcium scores and coronary CT angiograms, exploring the differences between these two modalities. Infographics can make comprehension faster. Here we have one infographic by Evelyn tackling a very complicated topic, constriction. And we can see how obvious the pathophysiology is here, and we can understand about ventricular interdependence. Infographics can also increase engagement. And here we have a very nice illustration and an infographic by our very own fresh House Thomas Fellow Sukriti. This is a very engaging graphic that really draws the audience in. Infographics can be made to learn or teach complex concepts. Another of our fresh fellows, Carla, shows us here in her infographic by HFrEF Managed. Ahmed's notorious right heart cath infographic is an excellent example for how infographics can be very complex, not just necessarily small and quick reads. It's actually a vertical infograph that I broke into two. You can find the full version on the CardioNerds website or likely even in your CCUs. There are two types of infographics. Those where the visual elements are not relevant to the data. They're meant to engage the audience, as we can see in this left infograph. And infographics or visuals are critical to understanding the data. We can see this illustrated in the infographic on the right. Reviewing the illustrations about the aortic root and the various valve morphologies here is essential. What can we do with the data? We can show hierarchy and sequence. This infographic about cardiovascular prevention done by Ahmed shows sequence for risk stratification and management principle. We can group and categorize things. This infographic by Dino clarifies the steps to go through in the pre-TAVR evaluation. We can also break the data into components. Visual abstracts are a great example of this. Here we have one done by Naja. The information is very nicely organized to show the background, results, and conclusions. This is not a CardioNerd infographic. It's just an illustrative example that could potentially be used in a QI infographic to show cause and effect. We can also use infographics to provide a step-by-step narrative, masterfully illustrated in another infographic by Ahmed about frequently asked questions in the cardiovascular disease prevention clinic. We can also use infographics to show time and timelines. This, for example, is a timeline with the review of major heart failure trials that we used in one of our journal club literature reviews. We can use infographics to look inside as cutaways. This is a beautiful National Geographic infographic. Congratulations to Devesh for winning the CardioNerds Award for this infographic this year. We can see a great comparison about the main treatment options for AFib and AFlutter. We can also identify and label elements. This type of infographic is frequently used in anatomy illustrations, but not only. We can also use infographics for emphasis. And here we can see the different colors of the fish used to show the positive and negative studies. This is a table taken from the literature review for our very first journal club discussing the strength trial. How can we make a conscious effort to make a great infographic? We're going to talk about the content and the design of an infographic. Let's start with the content. It's essential for the content to be correct. You should always consult multiple sources for your infographic. You can go over CardioNerds episodes, do PubMed searches, review guidelines, and talk to experts. Make sure you have a broad understanding of the topic you're working on and that the information is up to date. You can also consider using a timestamp as well. Always proof, look for errors, and remove typos. Seek feedback throughout the entire process. Here I'm using Ahmed's infographic to show that the feedback and improvement process can continue after an infographic is published. You can see in the upper right corner of the image that this is the second version of the graphic after feedback from the expert public who reviewed the content on Twitter. The content must also be clear. It should be easy to read and have a natural flow. Here we have an example by Naja where she guides the reader through the definition, epidemiology, clinical presentation, and risk factor of ANOCA. The content must be clear. You should focus on avoiding too much text. Let the visuals do their jobs. Show, don't tell. We can see this infographic by Tommy explaining the pathophysiology of aortic stenosis in a visual way where the illustrations do all the talking. It's also important to mind the hierarchy. The order for the elements in your infographic should make sense. Start with your key point and emphasize important points. Here we have two examples on how to arrange and to make important data stand out. Remember that you can emphasize things by color, position, top versus bottom, or size of the text or your pictorials or images. We're going to go over a few design tips as well. When talking about design, remember the structure is important. Have a plan and try to sketch your infographic beforehand. This infographic that I made about this year's CardioNerds Academy has many elements. I used a grid line to keep the content organized. The elements are aligned and the margins are equal. It's more pleasant to look at an infographic that has good structure. After your initial research, it's okay to have a lot of information in your graph, but as you refine your design, you should remove as much text as possible and as many unnecessary items as possible. In this visual abstracts I made, you can see I avoided large blocks of text and I used symbols to make the information more easily readable. Elements are also spaced out and arranged with purpose. Make the content scannable. Audience should be able to review major headlines and to get the main points. This infographic by Gerline makes diuretic resistance easy to understand because the information is clearly presented and organized. You can go over the pharmacology and physiopathology easily. The infographic should have a dominant image to anchor the graphic. Here we have two examples. On the left, we have an infographic by Dino, where the image of the octopus is used to engage the audience and to organize the data around it. Whereas on the right, we have an infographic by Rick, where the central image is an essential part for understanding the data around it. Color is very important for an infographic. This color scheme should be logical. You should use beautiful colors. Unattractive colors or combinations can make the audience cringe and skip your infographic. Avoid using too many colors or colors that are not complementary. There are multiple resources online to help you find good color combinations. You can also find sites that generate color palettes. See the end for some resources. You can use templates. The upper right example is from Canva, or you can take inspiration from infographics that you like. The lower right examples are from the infographic website on BMJ. I'm again referencing Ahmed's infographic to emphasize that you should use color for clarity and to convey meaning, not just for fun. He very nicely uses blue and red to emphasize venous and arterial blood. You should use color judiciously. If everything stands out, nothing stands out. You can again see how in Ahmed's design, everything is very simple and clear. Use clean and simple fonts and limit the number of fonts to maximum 2 or 3. We can see in this infographic by Devesh that he has 2 fonts and the emphasis is made by size, color, and bolding the font. It's preferable to use sans serif fonts as it makes reading the text easier. Just so you know, serifs are those tiny tails at the ends of the letters. Remember, don't push your skill. If you can't draw, use photos. If you can't design, use online templates. If you can't write, have someone help you with edit. If you don't have time, just cut back on your ambitions. This is not to limit you. It's just an indication to make sure that you're efficient and that you don't give up while you're working. The point is to keep learning and to grow your skills. Hopefully, we'll be able to achieve this together in the infographics block. We saw multiple examples of good infographics. Here we have a few bad infographics. Just make sure you represent data in an honest way. If you look at the upper left pie chart, the numbers and sizes of the pie slices are clearly mislabeled. You should also use appropriate graphics. The data in the upper right graphic is presented in a way that gives a false impression that you shouldn't be concerned about the disease percentages. Keep your graphics clear and without clutter. The bottom images are poorly organized, the text size is inconsistent, the graphics are difficult to follow. Overall, they're incomprehensible. Just make sure if you're the team leader, you have to listen, let people do their jobs, and don't force your ideas on others. If you're the team members, be diplomatic, stand by your design ideas, and stay true to your vision. Together, we're going to create some beautiful infographics. Now we're going to go over the CardioNerds angle to infographics. I took this from Evelyn's presentation. She and her boyfriend came up with this very fun acronym. Start with thinking about who your audience is. In our case, it's going to be medical professionals, students, and sometimes maybe even patients. Think about what will engage your audience. What motivates them? What have they not seen before? Then you have to select the topic. If you use a podcast episode of yours as your source, make sure you choose a narrow subject. There are multiple infographics, and tutorials that can usually be generated from each episode. Also, don't forget to ask yourself, can this topic be well represented in a graph? Not everything can be conveyed properly in a visual way. As mentioned earlier, research, research, research. Gather as much information as possible. Use guidelines, PubMed searches, or experts as your resources. Once you have the information in mind, it's helpful to actually draw a rough sketch out. I have an example here of an infographic I've worked on with Katya, where she emailed me this sketch and we were able to come up with the image on the right. The design and information can change multiple times throughout the process, so expect things to look differently than your initial sketch. After all this, it's time to execute your vision. Canva is a great resource for presentations and infographics. You can find great templates and resources to personalize it. CardioNerds actually has a paid account that we can use for our infographic. You're also more than welcome to use whatever resources you want. We have people who know Adobe Illustrator and Photoshop. Those are all excellent tools. Maybe you can even share some tips for us as well. As mentioned, we have the Pro Canva account. You can find the logins in OneNote. We'll go over this together. Remember, this is a continuous process. This is another way Evelyn explained the angle of infographics in her presentation. Once you sketch out the layout, you might realize you need more data. So you're going to gather the information. This can happen multiple times, which is why the arrow on the left is thicker. Once you go to Canva to execute your vision, you may find more templates and go back and change your layout. Basically, the size of the arrows is meant to suggest it's more efficient to go through multiple versions before you are at the software stage, before you're ready to execute, as more difficult to change things and change the design when you're in the software itself. To make the entire process easier, it's essential feedback at each step of the way. We're all more than happy to review your work. Remember to do something new and creative. I'm going to review what we spoke about with this great infographic about infographics. You can see the full thing in the upper left corner. I cut it into two parts so that you can actually read it better. The ingredients for good infographics are a good storyline, a good topic, graphs, linear graphs, the data, flow charts, short text. These are all essential for a good infographic. Then the secret spices to make it successful are simplicity, understand how it's going to be used, learn from prior infographics, have clear message, know your audience, have a good brand, and just go with the CardioNerds perspective. Make sure the purpose is to learn, to teach, to make things simple, and to have fun along the way. Don't forget to include the CardioNerds logo in all of your infographics, and you can have black and white versions in the infographic folder in OneNote and OneDrive. Include your Twitter handle and always give credits to the collaborators. Remember to stay organized. Save your work frequently. Canva saves automatically, but I recommend at each major design change to duplicate the slide you're working on and to save the old version in case you'll need to go back to it. Store all your work in OneNote and OneDrive. We'll guide you through this as you start working on your digital education products this year. Since we're all going to be using the same Faust Thomas Canva account, please be respectful of each other's work and don't change or delete other designs. Also, name your designs clearly. How to start? You can take inspiration from questions you have in your daily clinical practice or challenges you encounter while studying. You can also go to the CardioNerds website and look for episodes that could benefit from illustration. You should check prior infographics on our website as well. This is a list of resources I took from the Coursera class by Carl Booth. These are some resources Evelyn had mentioned in her presentation as well. Thank you so much for joining. If you have any questions, you can find me on Twitter.